So I'd like to call the meeting to order. Welcome everyone to the August 17th, 2021 school committee meeting. In keeping with an act relative to extending certain COVID-19 measures adopted during the state of emergency, signed into law by Governor Baker on June 16th, 2021, this meeting will be conducted remotely over Zoom. Attendance by board members will be remote and attendance shall count towards quorum. This meeting will be broadcast live on Facebook and recorded on ECAP. This meeting is open to the public. We will take questions via the chat feature at the bottom of your screen. Please make sure you include your full name and address. We will do our best to answer all questions. However, we will not reread questions that have already been answered. Additionally, I would like to state that this meeting is a single agenda item with discussions of the opening of schools and COVID protocols. We will first hear from Dr. Cabral and Ms. Pruitt, and then the school committee members will have an opportunity to ask questions and provide comments. After that, we will open the discussion to public comment. Again, please submit your questions and comments through the question and answer feature. Remember to include your name and address, or we will not be able to read your submission. Depending on the number of comments we receive, we may limit comments to one per person to give everyone a chance to be heard. We will not reread repetitive comments, defamatory or abusive remark comments containing profanity, or comments containing personal attacks. All right. So update and discussion on opening of schools, including COVID protocols. Dr. Cabral.
Thank you. This evening, we are using the most up-to-date information we have to report to you where our district is in relation to where we were when we closed school in the spring. Unfortunately, as you are aware, we have a new variant, Delta variant, that is far more interested in our youngsters than the prior variation. And there are some concerns about their safety, hence some restrictions across the state and some recommendations for further restrictions. I'll start by saying that we have two major goals for this year. One is the health and safety of all of our students and staff. And the second comes from what we heard loud and clear from parents across the district in the spring, and that was that students were to be back in school full-time as much as possible. In order for those two things to happen, we are not recommending any changes to what we were doing at the close of school in spring at this time until we have the guidance to do so. As of now, the timeline this summer has been changing, very much so, from June, when we were told by the commissioner that there would be no recommended mitigation needed in the fall unless there were changes in the trajectory of the virus, which of course there have been. On July 19th, the American Academy of Pediatrics recommend a layered approach to make school safe for all students, teachers, and staff. And that includes a recommendation that everyone older than age 2 wear masks regardless of vaccination status. On July 27th, the Centers for Disease Control and Prevention suggested a return to indoor mask wearing. This is universal for all teachers, staff, students, and visitors to school, regardless of vaccination status. On July 30th, in collaboration with the Massachusetts Department of Public Health, the Commissioner of Education released new guidance. We were able to speak to him about his guidance and further speak with his staff this morning. And they are strongly recommending the wearing of masks, which was supported later in the day on July 30th by Governor Baker. In addition, over that same time period, we've met with our school nurse leadership, We've met with our unions. We have met with the Director of Public Health in Easton, our administrative team, our central administrative team. We've received countless emails. And other than parent emails, which I'll discuss in a moment, universally, everyone has recommended universal mask wearing when we return to school. This was further recommended by the Easton Board of Health at their last meeting. And in speaking with our local superintendent group, almost every superintendent, except for one who has a very unique situation in their district in terms of grades that they serve, plans to recommend universal masking to their school committee. We, like just about every other district, typically have our last school committee meeting of the summer at the end of the summer. But unlike other districts, we moved ours up because we wanted a little bit of extra time to communicate all of our plans as clearly and transparently as we can and answer any questions before school begins. Every district, rather every county in Massachusetts right now is either high or substantial level of transmission for COVID. Bristol County is currently high. It is because of this information, including all the data that has brought to our attention, that again, we are not asking for any changes at this time. However, because we are now dealing with vaccinated and unvaccinated individuals, there are some modifications that need to be made to our quarantining protocols. We are putting together those documents now, and we'll get them out to everyone as soon as possible. I can go over some of them with you. I did say I would get back to parent emails. I do thank everyone that took the time to email. In terms of the emails I received, they were overwhelmingly in support of universal mask wearing. I, of course, can't speak for any other people that received emails. I'll just speak for my office. In addition to the masking, you'll remember that we had 3-foot social distancing. The commissioner and DPH are not willing to put a number on social distancing, so we will endeavor to keep all distance at 3 feet, as I said, as it was done in the spring. We will endeavor to have more social distancing anytime there are mass breaks in eating, but certainly will exercise the use of outdoors as much as possible. Like in the spring, masks will not be required outdoors. They will and must be required on the school bus. That is a mandate. In terms of close contact, while the definition has not changed, the reaction and response has changed. And so anyone who is vaccinated and within 3 feet of someone who's positive may participate in alternative strategies to quarantine if we are able to put a test and stay protocol in place. So I'll explain what that is. Last year, many people probably heard of something called pooled testing. It's less expensive than individual testing for COVID. Unfortunately, well, obviously a child needs to have parental guidance in order to have the test administered. Unfortunately, the unfortunate part is that because we had so many parents unwilling to participate in the testing for their children, it made the results of any such testing completely obsolete. If you have 25 children in a classroom and 10 of them are not testing, you don't have an accurate indicator if you have 15 children taking a test and there are no positive cases in that test of 15, for example. We also didn't have the manpower to administer the tests. The test and stay is slightly different in the sense that if someone comes into close contact, they can participate in a Binax Now test, which is a rapid PCR test. They must have 5 negative tests in a row, 1 per day, in order to no longer need to test and simply monitor for symptoms for a full 14 days. We were told that this was a completely free alternative. Once we participated in the webinars about this, we realized the tests are free. There have not yet been any offers of staff to administer the tests, which could be hundreds upon hundreds per day. So I communicated directly with the Department of Education, and they answered that they did not have that answer at this time, that they're working on whether staffing will be included. So as of today, unfortunately, we cannot guarantee that we will be able to do test and stay. We are still waiting to see if we can have a reliable funding source to have staff available to travel to different buildings to test as needed. But we're certainly pursuing that as an option, and we'll let you know as soon as we have any further information on that. Some other modifications: the close contact definition was 15 minutes of being within 6 feet of someone. And that was cumulative minutes, and that has been modified, that those transitory brief encounters likely do not add up to a close contact. So it needs, there needs to be more substantive contact for 15 minutes. Couple of different scenarios that I certainly don't expect anyone to memorize, and this is a draft, so we will have this all in writing for you in our playbook, which is now offline if you try to access it, because we are currently working on it. People who are exempt from quarantine include anyone who's vaccinated and asymptomatic. Asymptomatic. Any child who's on a bus with a mask, the buses will be required to have the windows open, so there will be no contact tracing on buses. In classrooms, if students are more than 3 feet away and masked, they will be exempt from quarantining. And if anyone has had COVID in the last 90 days from exposure and they are not symptomatic in any way, they don't have to quarantine. Anyone who's positive, vaccinated or not vaccinated, will need to quarantine for 10 days, be released on the 11th day of quarantine as long as they are 24 hours fever-free and have no symptoms. Now, the test and stay for close contact would be 7 days from exposure, asymptomatic and masked, 5 days of a negative Binax test, and monitoring for 14 full days. If symptoms develop at any time, that trajectory can change. If they decide not to participate in test and stay, they will need to have the full 7-day quarantine, as opposed to coming in and testing for 5 of those days. They can return on day 8 if they test on or after day 5 and it's negative. That's very similar to what we had in the spring. If they decide not to test at all, there's a full 10-day quarantine required to be released on day 11. Again, that's all very different if someone is symptomatic. Anyone who's symptomatic, again, will need to return after symptoms are gone, after they have had a negative test, or on day 11 if they decide not to test at all. DESE's guidance is detailed, but it is a little difficult to follow for those that may have it. And so DESE is now putting together a family-friendly version to try to make this a little bit more accessible to everyone. As I said, we're working on our playbook right now. We found that to be generally accepted and understood by everyone last year. And so we'll do the same thing this year. Mrs. Pruitt, do you have anything to add to those details?
Yes, I just wanted to add that the reasoning for the playbook being right now as we are speaking is the scenarios with DESE's further guidance came out to us Friday afternoon. We had a webinar today with Russell Johnson from the Department of Ed where he clarified some of the misunderstandings that people are having. And there was additional information just an hour before this meeting, another webinar in regards to some of the testing protocols. So I just want everyone to understand why there's a delay in the updating of the playbook. We are receiving information, within the moment. So, and more information is coming. So that's why we thought it was best to take the playbook offline so that nobody would be confused and work on it while we're getting information.
And I certainly don't mean to imply that our colleagues' strategy of meeting next week is any worse or better than ours of moving it forward. There's something to be said for both. We're trying to have the conversation to give us as much time to publish information as possible between now and the start of school. They are obviously waiting until they have more firm information, and that's fair. So we hope that people will understand that if anything changes, that's because the information is changing on a daily basis. But we feel as though we have enough information at this point that isn't going to be changing, that we can put forward these strategies, the protocols for quarantining, as well as what will be in place from last year. In addition to what I've already discussed, we will still have the soapy water, we will still have the electrostatic sprayers, we will still have the Purell. What we won't have is as much of the printed distance markers in each school, because the distance now is not 6 feet, it's more as close to 3 feet as possible. But there is no mandated distancing. But we are going to endeavor, as I said, to continue with as close to 3 feet as physically possible, or being outside. So those visual cues may look different. Other than that, Anyone who wishes to maintain the use of a shield or a plexiglass divider or any other PPE or mitigating tool may certainly do so. Our goal, again, is to keep everyone safe and to reassess the situation as warranted based on the information, guidance, and data that we are given. Chrissy?
I also wanted to add that we as school officials are educators. Our main goal, obviously the safety of our staff and students, but also we know what's best for kids as far as education goes. And we need our kids in school. We need them in school. We learned that last year. We do not want a hybrid model. We do not want virtual learning. In fact, the commissioner has actually said any remote instruction will not count towards time on learning. So these are the parameters that we are within. We would like to do whatever we can to ensure that our children are in school for the entire school day, for as long as possible. So I just want everyone to understand that that is really a driving force behind this. And if that means that, the recommendation is universal masking, because we can't send a classroom home for a week. We can't. There's going to, there's other measures that will have to be taken as far as closing schools and making up days and all of that. That could be very, very difficult. But we're back to where we were last year. I mean, this is a very difficult time for all of us. This was not expected, not anticipated, except one of our school nurses did anticipate this. But we were excited to see the end of this. And now here we are all over again. So I want everyone to know that our hearts are breaking over all of this. There's nothing more that we want than to have COVID be over for our kids and our staff.
Several people have asked for metrics. Like last year, we don't have one metric for changing our trajectory. Certainly, it has been well publicized that 80 to 90% of a group as big as a school system would need to be vaccinated in order for that to be considered effective in mitigating spread of COVID. While we have over 95% of our staff vaccinated, and that's certainly a wonderful thing. Obviously children 12 and under, or obviously children under 12 are not yet able to get a vaccine. And of the 12 to 17-year-olds, we have just about 50% of them are currently fully vaccinated. And so we don't have that level of vaccination. In terms of physical education, music, singing, MIAA has not come out with any guidance on sports yet, other than what, again, was in place last fall. We're awaiting that, and certainly we'll report it to you as soon as we get it. But right now, since masks are not required outside, any athletic activity outside will not be requiring masks. Singing, music, wind instruments, again, we're encouraging outdoor use for that. Same for physical education. And as I said before, any mask breaks or lunch, snacks, eating of any kind. As Mrs. Pruitt said, unfortunately, remote learning, we don't have staff to provide remote learning this year. It's very difficult to have two modalities for staff. But beyond that, the Commissioner of Education is not considering remote learning time to be time on learning. So unfortunately, that would not count for those students. It is very important to note that under this current guidance, which of course the commissioner has the authority to impose, if a school or a classroom or a large group of students were to close, that time would need to be made up like a snow day. Therefore, if it's closed for 2 weeks, 2 weeks would need to be made up. That, and of course, the knowledge that our children and our young adults need to be in school are among the many reasons why we are not recommending any changes at this time. Some districts are actually advising their school committees that February and April vacation need to be potentially considered for makeup days, depending on what type of winter they have. We have not made that kind of recommendation or decision yet, but it is something people should be aware of. Because again, I have to repeat, under no circumstance is the commissioner accepting remote learning as time on learning. So if an entire district or school were to go online for the day, it would not count to our time on learning. I want to just remind people that there are medical and religious exemptions. It is very rare to have a medical exemption for wearing a mask, and I will say we had 0 last year. We did have several students encounter social emotional challenges last year, but none of them, not one of those instances was reported to us to be caused by mask wearing. Far, far, far too many of them were because of the social isolation, the lack of a consistent schedule or leaving the house, and being with the adults in the building, especially those that are special education or mental health service providers. And so that is how we are working to combat the social emotional problems this year, is making the schools available to our youngsters, making sure they're getting breakfast and lunch, making sure they're getting appropriate counseling by professionals, making sure they maintain their routines and have their social interactions. So we are very cognizant of the mental health issues, and we're addressing them based on what those issues were. We also feel it's really important to maintain the anonymity of any student who may or may not be vaccinated. And unfortunately, managing students and even staff who might be vaccinated or not vaccinated is something that the staff just cannot handle at this point in time. We are very shorthanded, and we don't have staff that is going to be able to take on that responsibility. In addition, we don't want students having to be publicly asked to put on their mask because they're not vaccinated. Again, we wish to maintain anyone's right to anonymity in their health decisions. And finally, we just don't know what to expect this year, because with all of these things in place last year, we didn't have the Delta variant. We were not high on the list for prevalence of COVID in our town at that time. And all of Massachusetts was not where it is now. And so we are, as Chrissy said, in a very similar situation to where we were last fall. However, in a much better situation in the sense that we can welcome our children back into school as long as we are able to do it with safety for all. And as we've taught our children, wearing a mask is not necessarily a personal choice. It's our civic responsibility and a social contract with one another to protect our most vulnerable. I don't wear a mask to protect myself. I wear a mask to protect others around me who are more vulnerable, who are younger, who don't have a choice of getting the vaccine. And so this has weighed heavily on us because we know that we all want personal choice for our bodies and for what we do. And in this case, the science just does not back that theory. The science says very clearly that we wear a mask to protect those around us. And we have vulnerable people, including children, medically compromised or aged staff. And we must maintain our commitment to keep every single one of them safe so that our kids can be in school. We can answer any questions if you'd like.
Thank you. Does anyone on the school committee have questions or comments? Jackie?
Okay, thank you, Dr. Cabral and Mrs. Pruitt. I can't believe we're having these discussions again. I was really hoping we were done, but we're not. Okay, will we see school-specific plans regarding COVID protocols or just an overall district plan? Like last year, every school had their own plan. Is that going to be the same thing, or how is it going to work?
Only to the extent that it has an individual impact on the school. So for example, we did have a district plan last year that all the schools followed, but there were some graphics and visuals, for example, of where students would enter a building or exit a building. Things like that are very specific to particular schools. And so anything that is specific to a school will come from the school, yes.
Okay. Now, I know you said we're going to try to keep 3 feet distancing where possible. How realistic is that?
Depends on the building.
Mm-hmm.
Obviously, for example, when students are passing in the hallway at the high school, for example, they may not always have 3-foot distancing. There may be activities where a student may get closer than 3 feet. We haven't gone physically through every building so far. There are some differences from last year in terms of people may have noticed some storage containers that were outside every school. We had taken out furniture in classrooms to make more space. That has been returned. Certainly, if anyone needs furniture taken out again, we can do that, but the teachers haven't been in their classrooms yet. So we are still going through all the buildings to see if it's possible for everyone to be 3 feet apart at all times. But something like passing in the hallways may not be the case. We also borrowed hundreds and hundreds and hundreds of desks from other districts for things like lunch in the cafeteria when there had to be 6 or more feet between children when they were eating, and those have all been returned. So we're going to try to use outdoors as much as possible. For example, in elementary, students now will be at assigned seats in the cafeteria as opposed to in their classroom like they were last year.
So that was what I was going to ask you about, is lunch. So when it can't be outdoors, it's going to be in the cafeteria in each building?
Yes.
Okay. And obviously you said the desks will return, so kids will be sitting at tables.
Right.
Okay.
Again, whenever possible, there'll be as much distancing, there'll be as much facing the same way as possible. But again, we're still going through every building to see where we're at with that. But everyone, unfortunately, is very experienced at this point. They realize the more distance, the better. So while I say that we're endeavoring to maintain 3 feet, everyone knows that more than that is better than that. So we're going to do that wherever possible.
And what about recess? How is recess going to work?
Recess is, if it's outdoors,
Mhm.
it's only indoors when it's inclement. If it's outdoors, students are not required to wear masks outdoors.
And they're not going to be kept apart. Or I know they were kept in groups last year. That's not going to be done.
Well, there are no cohorts this year,
Okay.
so it won't be done in cohorts.
Mhm.
But again, there were modifying activities that students would be encouraged to play or participate in, as opposed to more close activities. And so
Mhm.
again, whenever possible, we're going to endeavor to do those activities
Okay.
to reduce the amount of contact with one another.
And I know you said you still have the deep cleaning equipment.
Yes.
And you have all the PPE that you need?
Yes.
Are we still going to have the hand washing protocols in the classrooms and the hand sanitizing stations?
Yes.
Okay. I'm actually anxious to hear when you get some more information about the test and stay program, because it does seem like if we could do testing in the schools, that would be a great idea. Let's see. And then quarantining, you're going to get back to us a little more on that. Do you know who's going to do the contact tracing this year?
No, that's part of what we're looking for. If we can, we have just advertised for RNs and LPNs for extra help in schools, but also to help with contact tracing. And again, I'm waiting to hear if the test and stay is going to be manned by the state.
Sure.
So that we don't know yet. It's confusing because, not to add to confusion, but we were asked to fill out documentation that we were interested in participating, which we did. And in it, it asks how many people you want to help, who you want them, what roles you want them to fill, how many hours you'd need them to be there, day of the week, but yet they're telling us they don't know if it's funded yet. So it's confusing because you get very excited when you see something like that. Sure. And you pull it out and you say, yes, send me 15 people or whatever. And then they say there's not funding for it right now. So we're getting mixed messages. I know they're endeavoring to try to get the funding, and so they'll let us know and want the information should they get it. But obviously it hinders our ability to prepare as much as we would like to.
And last year, sorry, go ahead.
Clarify about the test and stay is that the test and stay, and we are learning more and more about it every day. It is for unvaccinated students that are asymptomatic. So vaccinated students that are also asymptomatic would not have to go through the test and stay protocol. Okay. It's to keep the unvaccinated in school so they don't have to quarantine at home.
Okay, thank you. Are they doing in the schools? I know that I think they had seating charts last year. Are they doing that again this year for contact tracing purposes?
Yes.
In all of the schools are going to be able to do that? Okay.
Yes.
Have you been hearing about if there's going to be the same shortages of substitutes this year, if that's going to be a continuing problem?
Yes. And again, people have asked how they can help, and I've encouraged people to apply to be substitutes. Unfortunately, many people have expressed an interest in helping. Very few have actually signed up to be a substitute. But truly, if people are looking to devote their time in a way that will make a huge difference for us being able to keep schools open and still have choice of what days you might want to come in and work, so there is flexibility, that they should contact central office and apply to be a substitute. We are in desperate need of substitutes and will be for the entire year.
Okay. And as for buses, I know you said they're going to keep the windows open as much as possible. Obviously, if there's not any distancing, they're not doing seating charts on buses. Is that what you said?
Right, because there's no contact tracing on buses.
Okay. So, and masks are a mandate on buses right now.
Yeah.
Are they going to be following the same cleaning protocols as last year? Like cleaning in between the runs?
They clean every day. I don't know if they do. I'll have to check. Whatever they were doing in the spring.
Okay.
They'll be doing, yes.
Okay. So if it's, Michelle, if it's okay with you, I just wanted to make a couple of comments, unless you want everyone to go through questions first, however you want to do this.
No, go ahead.
Okay. So I'm not a medical professional. I'm not a scientist. I'm a policymaker, right? So I have been reading as much as I can, taking in as much information as I can, reading all of the emails. I really appreciate it. I know we all appreciate all of the parents and community members who have reached out to us in one form or another, provided us articles, provided us data, provided us their opinions as well. And so I've been also looking at the DESE guidance, Massachusetts Association of School Committees, Department of Education, as Dr. Cabral said, the American Academy of Pediatrics and CDC. And I've looked at what's been going on around the country, which is honestly, with this Delta variant, been scaring me. I have a child who is not able to be vaccinated yet. And I'm looking at case counts in our state going up with young kids. I'm looking at what's happening in Florida. I'm looking at the thousands of students and staff who have been quarantined since school has opened in Florida and Kentucky and Mississippi and South Carolina, Indiana, Arkansas. It's really like nothing I feel like we saw last year. So in looking at the guidance from the American Academy of Pediatrics, it's always interesting to look at the guidance, but kind of then you need to look at the reasons behind their guidance. And so some of their reasoning that stood out to me was that we do have a significant portion of students who are not able to be vaccinated yet. And even of the students that can be vaccinated, only about a little over half are vaccinated. This variant seems to be spread much more easily than previous variants or the original virus, which is something that the CDC has said as well. As we know from what happened in Provincetown, vaccinated and unvaccinated people are getting the virus, and they seem to be carrying the same viral load, although the vaccinated people don't keep it as long, so they're not transmitting as long. This is all an overwhelming amount of information for me. So what I then do is I'll look at how does this apply to us in Easton? So what has been helpful to me is to look at the advice we're getting from other town offices in Easton. Like we know the town is now mandating masks indoor municipal buildings, regardless of vaccine status. The Board of Health has sent us a letter recommending universal masking in the schools. And I would recommend anyone to go back and watch that Board of Health meeting. I think it was last week, because they had a very interesting discussion. And Kristen Kennedy, who's Director of Health and Community Services, one of the things she said is, besides the fact that positive cases are increasing every week in our town, previously she would see spreads within households, but what she's seeing now is different. She's not seeing that. And what she has been observing is that that if there's a case within a household, it's not necessarily that the other members are getting tested, or they may be using private testing. So those numbers aren't being reported. So the numbers that she believes are actually underreported. So that was interesting, because I didn't really think about that. She also went over the vaccination rates in Easton, and for 12 to 15-year-olds, it's 58%. So as Dr. Cabral said, just a little over half. So that was interesting. That discussion was very interesting. I also appreciate that the Easton Educators Association has come out with their views as well. That's helpful. And as both Dr. Cabral and Mrs. Pruitt said, we don't know what to expect from this variant. This seems to be different than what had happened with the original virus and variants and the other variants. So in order to keep our kids in school and keep our kids and our staff safe, to minimize disruptions to their education by having large groups having to quarantine or classes without teachers, we don't have cohorting. We have distancing as much as we can, but it's not like last year. I think at this time we have to use whatever mitigation strategies that are available to us. And to me, from everything I've read and from listening to the medical experts in our community, I believe that we should have universal masking in our schools. And we do have that policy in place already. So I think we should just keep it. Thank you, Michelle.
You're welcome. Thank you. Anyone else? Jen?
Just wanted to get clarification on a couple of things in the quarantine protocol from DESE. So I guess 3 questions. One, is this something that DESE is mandating as the protocol, or is this a recommendation from them?
Which part?
The whole, the memo from August 13th. So their whole 12 pages of if-then scenarios, is this the protocol that every district will be following, or is this something that we need to vote on? It just wasn't clear if this was local discretion or not.
This is strongly recommended, but this is already in place in Easton, so you don't have to vote on anything unless you want to change what we're already doing.
Okay. And then my second, I guess, point of just seeking clarification. So close contacts are within 6 feet of somebody positive while indoors for at least 15 minutes, et cetera. So in a lunch situation where kids are unmasked, the radius would be 0 to 6 feet. And we would be contact tracing based on seating assignments or using QR codes or something in the high school during lunch.
Seating assignments and QR codes. The definition of close contact is 6 feet, but the requirement for contact tracing for close contacts is reduced to 3 feet.
What happened in the spring was that we did notify parents if they were within 3 to 6 feet, but they just to monitor them. They didn't have to
we didn't
quarantine.
require quarantining.
Okay.
Yeah.
And then within the classroom,
Mm-hmm.
as long as students are masked
Mm-hmm.
from 3 to 6 feet, they are not considered close contacts in terms of needing to be tested or go through quarantine response.
Correct.
But so if we did not adopt universal masking, then that 3 to 6 feet group who aren't fully vaccinated and are not asymptomatic
Mm-hmm.
could possibly be subject to close contact protocols, testing,
They would have
quarantine,
to
et
be
cetera.
quarantined. And
Got
yes.
it. Okay. All right. Just wanted to make sure I understood that. Thank you.
That it, Jen?
That's it for me for now. Thanks.
Caroline, I think I saw your hand up.
One of the people that emailed us, and I do want to express my appreciation to the many, many people who emailed the school committee offering support for our work over the past year and a half, and also honestly for universal masking. But one of the people had said, masks are not fun for anyone, but they protect everyone. And this is, of course, what Leisha was referring to. One person wearing a mask, I've looked at probably about 20 studies, lab studies and real world studies about the effectiveness of masks. And of course, there's tremendous variation because it has to do with the quality of the mask, the fit of the mask, how people are actually wearing them, if they make sure to keep them over their nose and mouth, etc. But in general, it seems as though if one person out of 2 is wearing a mask, they're protected from transmission from that other person by about 40 to 55%. But if both people are wearing masks, both people are protected from about 84 to even as high as 94%. So that's a huge difference. And there's a kind of misperception that if a person's wearing a mask, they're protected. They're just completely protected, but they're not. It has to do with the other people that surround them, how much they're protected. And getting back to Dr. Cabral's point, of course, the main reason we wear masks, even if we're vaccinated, is to protect those around us. So I do think that there's, actually a misunderstanding about how effective it is for an individual to wear a mask, how well protected they are. So I just wanted to mention that. And also, and we have received emails from parents who've been concerned about, masks getting wet and dirty and so on. And I do think it might be a good idea for parents, if possible. You'd have to probably have quite a few masks on hand, but to send a couple of clean masks every day with their kids. And then when the mask does become kind of unusable and they can, I don't know, get in a safe place for a minute to exchange the dirty mask for a clean one, that's a possibility. Not every child, of course, has the same level of difficulty in terms of the mask becoming wet or dirty, but I do think that it's not a bad idea to have parents provide some extra masks, and also to make sure, that they're always clean to begin with each day, and that children know how to fit them to their faces appropriately. Most of the viral particles are actually in the nasal pharynx. Kind of drives me crazy when people wear a mask under their nose, because the nose is the primary site of the virus, certainly the throat as well. But when you skip the nose, you're basically reducing the efficiency of the mask by over 50%. So I think also parents could take some time to just show their kids how to wear the mask appropriately, to find masks that fit their adorable little faces. I just think that it is the solution to, we just hope so much, keeping kids in school. We just don't have a lot of other resources. I hear about private schools that have 10 kids in a class and they're able to provide outside extra staffing and so on. And, but we're just not in a position to do that. So our main mitigation measure really is universal masking. And I do understand that some kids are uncomfortable or just don't like masks. I don't blame them. But I do think that the attitude of the parents has a lot to do with how the kids accept masks or don't. I think a lot of kids, my experience with kids is that none of them complained about masks. So I think that sometimes they, in trying to be protective of their children, parents may communicate that there's something really bad about masks to their kids, and that can be alarming to them. But I think a sort of lighthearted, philosophical, we need to protect others, we need to protect ourselves attitude could go a long way with helping kids accept the masks more readily. Okay, that's my little, my TED talk for today.
To your point, I just want to add that masks are always available. Every teacher has plenty of surgical masks that are clean and unused in their classrooms. They restock it whenever they need to. We already have all of them for this school year, and they're in the schools. So a child can put on a new surgical mask every hour if they need to. I don't want anyone to feel burdened about the masks. We certainly have those available for every person in our buildings, and that includes students.
Well, Dr. Cabral, thank you for bringing up surgical masks. There's lots of little YouTube videos about how to kind of adjust a surgical mask so that it fits the face very well. I know that might not be too easy for elementary school students, but certainly middle school and high school students could learn very quickly how to adjust a surgical mask so that it fits the face very, very well and really provides additional protection because of the fit. So thank you for bringing that up.
Is that it, Caroline?
Thank you.
Okay. Nancy?
Hi. So I would just agree with everybody, especially Jackie. I think she and I must be on the same wavelength somewhere, but totally appreciate people letting us know how they feel. And I am in support of universal mask wearing.
Thank you. I have a couple questions. Are we going to need to add lunch periods this year?
Not
Like
at
last
now.
year? Not. We can do
Because
that 3 feet.
Students are not going to be eating in their classrooms. They're going to be eating in the cafeteria.
but we have enough space in all our cafeterias for roughly 3 feet. And okay,
Well, again, we're going to try to be outdoors to maintain the 3-foot distancing. It's
Okay.
only in inclement times that we would need for the students to be indoors. And as of now, we have the same schedules we had prior. So there are no lengthened, mostly that happened at Richardson Olmsted. That is not in their schedule this year.
okay, thank you. My recollection with the pool testing, and maybe it's different, and I have 2 questions. One's going to be about the 5 rapid tests and about pool testing. My recollection was that originally it was almost like we got a kit or a supply that was free, and then after that it was become very costly to keep a stock of tests. Is that the same scenario this year?
Well, the pool testing does not come with staffing to administer the tests, and we don't have enough parent participation to make valid results from pool testing. So we did not put in for pool testing this year. The test and stay is supposed to be, it's supposed to be enough tests to keep us going until it's no longer needed, but they have not given us a number on how many tests. They have not sent us any tests, and they have not committed to any staffing to help with it. So I don't have that answer just yet.
Okay. And how are we this year handling volunteers in schools? And I mean that aside from subs that may sign up, but parents who come in and help with various programs or the classrooms or whatever. How is that going to work? Or are we doing that?
Again, it depends. We're trying to keep everyone distanced 3 feet. It certainly will help if they're vaccinated, but we are not mandating a vaccine for anyone, not students or staff, but it becomes more complex if they're not vaccinated. We are not making a broad statement on volunteers just yet because we're still trying to figure out what we're going to run. If we think about our regular assemblies or activities, if we're not able to keep distance between students that we feel is safe, it's not going to run, and so we won't need the volunteers.
And do we have an anticipated date roughly when we would hear about guidance on music programs and sport programs? Like if those organizations said by such and such a date guidance will be out?
No, I have no indication they're going to send guidance at all, other than outside whenever possible.
Okay. All right, that's all my questions. And I also do support universal masking. I just wanted to say that. Anyone else? Caroline?
I did want to mention one other thing. I have seen a lot of claims that, children just don't get sick. Children will be fine. I've even heard many times there is 0 risk to children. None of those things are true at all. It is true that with the earlier variants, children were much, much less likely to become ill, hospitalized, or worse. But with the Delta variant, that is simply not the case. I mean, ICU beds pediatric ICU beds in the South, where the virus is really raging, are at capacity now in many states. So, and there's no real reason to think that Massachusetts would be spared this uptick in pediatric cases. I think overall we'll do better because we have a higher vaccination rate. But, the other thing about the Delta variant is that people who are vaccinated are much more likely to have breakthrough infections than they were with the prior variants. So I think it's just a fault. People heard so often, so early on, kids will be fine, kids are safe. But unfortunately, this Delta variant has really upended the whole situation, and it's far more dangerous for everyone, including children.
Thank you. Anyone else last comments? Jen?
Regarding sports, can you remind me, are there any fall sports that are indoors? Is volleyball fall? Just wondering if this is something that
I actually
is-
had to
we're-
cancel a meeting with Bill Matthews today in order to attend the DESI workshop.
Okay.
So we haven't had an opportunity to discuss any of the indoor fall sports. So
Okay.
we will get that to you as soon as we can.
Okay, great, thanks.
And Bill Matthews is also meeting with his colleagues, the other athletic directors in the surrounding areas tomorrow.
Because no, just to clarify, we have not received any guidance from MIAA yet.
Anyone else? Okay, all right. Public comment, Chrissy?
Sure. Okay, Erica Mandel, 50 Main Street. How do you handle medical exemptions? What will that look like for children that need one?
Again, we had none last year, but certainly if someone has developed a medical condition that makes it impossible for them to wear a mask, they receive a note from their doctor and turn it into their school nurse.
Bill Donahue, 45 Forest Edge Road. COVID testing is generally deemed not to be effective until day 5 of exposure to COVID. Test to stay programs suggested by the state could potentially expose hundreds of students with false negative tests, which may not show up until at least day 5 of exposure. How will our students be protected under this scenario? P.S. Federal guidelines require universal masks on public transportation. Please confirm that masks will be required on school buses. Yes, they will be. Thank you.
Was there another question other than that?
Yeah, his question was, how will our students be protected under this scenario where the
Well, oh, sorry. So that's right. So that was true for the variant last year. And what we're learning is that the Delta variant actually tends to show up sooner than that. That is the guidance we received. And further explaining that any further, I do not feel qualified because I am not a medical professional, but that is the guidance that we received. And yes, they are required on school buses, as we said before.
Okay. Maria Pacanzi, 5 Wedgewood Drive. Do you have past data on school transmission? Pretty sure you don't have an answer to that. Okay. Do you plan on tracking school transmission? If cases decline, what metrics need to be met by this school committee for these kids to not wear masks and be smiling children again?
So we do have data that there was no school transmission because we track students who are positive and where they may have a positive case, we then check their close contacts. Of course, we only know the ones at school. We don't know about the ones outside of school. But when tracking the close contacts in school, those students then did not become positive. So that would mean no school transmission. We intend to track it the same way this year. And if cases decline, obviously those are the metrics we would look for. But again, we're not making these decisions because none of us are medical professionals. We are taking the guidance from medical professionals. So that's more of a question for American Association of Pediatrics or the CDC.
Kathleen Geneva,
Can I
30.
just add, I and Mrs. Pruitt went in many classrooms over the course of last year. And even in the heightened 6-foot social distancing, our children in school were very joyful and happy to be with their friends. And they were smiling. I couldn't see their smiles, but I could see in their eyes that they were smiling. They were laughing out loud. We were all having a lot of fun because the most important thing is that they're with their peers and the teachers. And we want to make that the case for everyone this year.
Kathleen Genova, 31 Arbor Way. Please clarify whether fully vaccinated students will be exempt from the contemplated test and stay protocol for close contacts. Thank you.
As long as they are asymptomatic.
Kristen Pelfrey, Evans Circle, Northeastern. Question: what will determine when masks can come off, and will the frequency and duration of mask breaks be increased?
Again, We're going to go by our metrics in our town based on the professionals that we take our guidance from. And what was the second part? Sorry.
Will frequency and duration of mask breaks be increased?
The mask breaks are given as students need them. And so as students need them, they will be given.
Alexandra Warnick, 17 Blackbrook. Given that the state has said that any amount of virtual learning will not count towards time on learning, what is the plan for those that must quarantine?
Just as if a student in the past was out for any amount of time, including an extended amount of time, the teachers will work with them to provide all of their makeup work to make sure that they have everything they need to be caught up with their peers. Unfortunately, even extended absences are not something that we aren't used to. Children are out for many reasons. Sometimes they have chronic illnesses or very serious illnesses and are out for quite a bit of time. If necessary, tutors are provided, but that is a very extraneous circumstance and is on a case-by-case basis.
Maria Pacanzi, 5 Wedgewood Drive. Massachusetts has one of the highest vaccination rates in the country, around 60%. For clarification, are you saying that the metric of 80 to 90% of our children needing to be vaccinated before these kids can take off their masks? With a metric like that, this requirement almost sounds like you are mandating vaccines. Are you? It's our choice.
Not mandating vaccines. We're not mandating vaccines for children or for employees. I am simply repeating that what was told to us by our medical experts, and that was that the vaccines would really only be effective in providing a higher level of safety for people around us if 80 to 90% were vaccinated. That's all. I'm just repeating that statistic. It is not a metric. I want to make sure that I repeat that we do not have a specific metric because these numbers are changing all the time, but so are the variants, so are the variables, and we are not medical experts. So we take our guidance from medical experts.
Aileen Newton, I just want to let you know that your address and there is no, it's just your name here. There's no address and no question. So I just want to let you know that. Jane Martin, Armor Lane, thank you very much for your continued focus on the health and safety of all our students and staff in the district. The administration and school committee continues to understand that they have a responsibility to all the voices in the district and not just the loudest voices in the district. I'm so thankful that you are willing to carry this heavy burden on behalf of our students and staff. How can members of the community help and support your efforts?
Thank you. Your positive comments are extremely helpful. In addition, as I said before, it bears repeating, if anyone is in a position where they can apply to be a substitute in our schools, that is the absolute most priceless thing we can ask for right now. Substitutes will be paid, of course, and we are at a very, very strong need for substitutes and will be for the rest of the school year.
Dennis, I just want to let you know, I don't have your full name and your address, so I cannot read your question. I will go back if you type it in the chat, I can go back and read it. Kelly Morton, 104 Gaslight Lane. Are you planning, how will we do remote hybrid off DESE? I'm sorry, she probably meant if DESE does end up changing their guidance during the year. If a lot of schools end up having to close for long periods, perhaps they may. Just seeing if Plan B is being thought out now, so it would be seamless if it does end up happening.
The commissioner's made it really clear that that's not going to happen, but if he does, we've done it already. So we are in a position to do it, but we have no intention at this time to consider that at all because it doesn't count and we don't have everything in place right now for it to happen. It certainly wouldn't be a change on a dime. So we would have the opportunity to meet with staff and talk about that, but that is not on the radar at all right now.
Erica Mandel, 50 Main Street. Would permission slips need to be signed for the test and stay program? I imagine permission would be needed to administer a test on a child, correct? Thank you.
Yes, it would need to be permitted, but again, the alternative is to stay home for quarantine, which is perfectly fine. Parents can elect to do that as well.
Laura Shea, 26 Miller Road. Thank you for mandating masks and following the CDC's guidance.
Thank you.
Dennis, again, your next comment I can't read. Holly Butler, 927 Washington Street. Does EPS utilize disinfecting spraying of classroom areas?
We do. We have electrostatic sprayers that are specially designed to cover all surfaces. It is food grade and non-toxic. We're going to continue that this year. In addition, soapy water has been just as effective in many applications, and we'll be using those in the same applications this year.
Carrie Rapolo, 5 Crystal Lane. So many parents begged for in-school learning last year that you were so adamant that you had to keep the hybrid learning to keep kids safe. These kids suffered under your decisions based on fear. So how am I supposed to believe that you are an expert on mask wearing and what is best for our kids? We have spent this summer at camps, sports, vacations, concerts, personal play, and you are now taking that norm away from our kids by mandating masks. The 3-foot mandate is also hindering our children's social and mental well-being. You are all mistaken, sadly. This has nothing to do with parental complaining. My kids don't want to accept the mask because they get headaches and they get too hot. Masks are a petri dish.
Okay. The only question I think I heard was, how can we be trusted as mask experts? I do not claim to be a mask expert. My staff are not mask experts. We consult medical experts, and that's how we base our decisions.
Sarah Ibanez, I also can't read your comment because I don't have your address. Sorry, I'm just scrolling down. Melissa Pinellatori, 6 Tamarack Lane. Will you have the same rules regarding travel this year? Will the kids have to quarantine before allowed back into school?
Right now, there are no travel guidelines for vaccinated individuals. It's for unvaccinated individuals, and it would be the same as last year for unvaccinated individuals.
Kathleen Sheehan, 10 Harrison Avenue. Throughout last year, the superintendent and school committee informed that they had been in regular contact with the Easton Board of Health. However, during the August 9th Board of Health meeting, board members stated that they were never consulted last year. In addition, the playbook referenced collaboration with the Easton Board of Health. Can you please clarify if the Easton Board of Health was consulted last year, understanding that they are a board and need to act in accordance with open meeting law? If not, why?
So I serve as an agent of the school committee based on my meetings with the school committee. And Kristen Kennedy acts as an agent of the Board of Health based on her meetings with the Board of Health. I think that the Board of Health is aware now that Kristen Kennedy and I met multiple times every day throughout the entire school year last year. And together we created the playbook and all of our recommendations, including those this evening.
Allie and Greg Shea, 40 Union Street. Thank you for showing the bravery to protect our community's children and their loved ones in the face of the unfortunate politicization of a measure as simple and effective as masking. We are proud to be members of this community.
Thank you.
Lori Hahn, 19 Wenlock Street. Another important consideration is protection from dual infections, Delta COVID and RSV, Delta COVID and flu, which can be more severe. Masks help decrease spread of flu. The reason why flu was so low last year as well. Okay, Allison Piantadosi, we already talked about travel guidance. If there's something else you want asked, please ask. Kathleen Sheehan, 10 Harrison Avenue. If the school committee is willing to mandate masks for children, then can we assume that you are willing to mandate vaccinations for school staff? If vaccinations are our strongest tool and their efficacy is supported by real world evidence, then why are we not mandating the use of the most effective mitigation measure first? Why does our social responsibility end at mandating masks for children?
That's a great question. We don't have to mandate it for staff. Over 95% are already fully vaccinated. So we don't have to mandate it.
Okay. Dennis, I see your name and address, so I'm going to go back up after I read some of these. So thank you for putting that in there. Amy Gershman, 53 Center Street. Thank you, school committee and administrators, for your tireless efforts to keep our kids safe. Also, thank you for following the science and Board of Health recommendations and doing everything you can to stop the spread of COVID in our schools and in our town. I couldn't agree more that wearing a mask is our civic responsibility. I respect and appreciate your decision very much.
Thank you.
Jana Goldshine, 12 Rosie's Way, South Easton. What will the travel requirements look like? Sorry, I didn't read that beforehand. Meaning if you travel, what will be required to return to school? We discussed that already. Matthew Matera, 93 Pequanatuck Ave. Thank you very much for your work and for prioritizing student safety. Universal masking makes me feel much more secure as my son, who is too young to be vaccinated, returns to school.
Thank you.
Kathleen Sheehan, 10 Harrison Ave. Number one, why is EPS not continuing the use of cohorts when this is recommended by the CDC as a mitigation measure? Are we simply picking the measures that are easiest for EPS to implement regardless of their impact on students?
No, actually, the commissioner has said that space will not be allowable as an excuse for not having in-person learning. So we don't have a choice. We can't fit everyone in at 6 feet unless we have, as you said, cohort A, cohort B. It will not be counted as time on learning. And if we want school to actually count for our students, we do not have a choice. We have to have everyone in school. That is why DESE will not give a number for distance. It recommends over 3. It does not recommend 6 feet anymore.
Are you really allowing, and again from Kathleen Sheehan, number 2, are you really allowing unmasked children to eat, obviously unmasked, less than 6 feet apart? How is this an effective mitigation measure and how does this fit with CDC guidance?
They're hopefully going to be eating outside. When they're eating inside, they will be more distance, but when they're eating outside, they're not required to wear a mask at all. So eating outside is the preferred choice, obviously, except in the most inclement weather when they'll be eating indoors spaced apart.
Again, from Kathleen Sheehan, if you cannot quarantine 3 feet and are not willing to change your quarantine requirements, and you may not implement the test and stay program, and you are using cases as a measure of public health, then how is the school year not going to be significantly disrupted?
Well, we believe we can get 3 feet everywhere. We are changing the quarantine requirements. I did go over those a bit earlier, but they will be coming out in the playbook. And we are trying to implement the test and stay. So hopefully those will not be issues. If they are, then we'll have to do something else to not disrupt school. That is our goal, to not disrupt school.
And Kathleen Sheehan again is asking Caroline to provide any evidence to support your claim that the Delta variant causes more severe disease in children.
I wouldn't even know where to begin. I would suggest just checking the box for coronavirus, looking up New York Times, Washington Post, Boston Globe, CNN, ABC News. I mean, virtually every expert, every infection control expert, epidemiologist, et cetera, has said that the Delta variant is clearly more transmissible. And what we don't know is if it actually does in and of itself result in more severe illness for children, but because so many more children are contracting it than the prior variants and are becoming ill, it's difficult to, it's sort of like an apples and oranges situation, but there is no question that there are many states now that have effectively lost their pediatric ICU capacity. Children are, and in fact, a couple of, I mean, where I get most of my information is from the major media outlets that I trust. As I said, the Times, the Globe, Washington Post, CNN, and ABC News, etc. But honestly, you can just look in any major media outlet and find countless reinforcement of the notion that the Delta variant is far more dangerous.
Dennis Gibson, 185 Lincoln Street. A total of 400 kids died from COVID last year, while 3 times as many died from the flu. You're not following the science. Why are you punishing those who have already had COVID or are vaccinated by saying it's a social contract? It isn't a social contract. Wearing a mask is a personal choice. How much input did the teachers union have in these decisions?
Okay, that's a lot of questions. Can you do them one by one, please?
Sure. The first one said, was more of a statement that we're not following the science because more kids died from the flu. And why are you punishing those who have already had COVID or are vaccinated by saying it's a social contract?
How do I what? Punish? What? I'm sorry.
Why are you punishing those? And I think that's for everyone, not just you, Leisha. It isn't a social.
We don't feel it's a
contract.
punishment. I did not.
Right. And then the other one was, how much input did the teachers union have in these decisions?
They're one of the maybe 8 groups that gave us their opinion. That's about the extent of it.
Dennis also asked, in bold letters on the DESE website, DESE and DPH recommend that schools allow vaccinated students to remain unmasked. Why aren't you following this?
They don't recommend they stay unmasked. They just strongly recommend that people mask.
Sorry, just scrolling back. Okay.
It's also, you know, I've been on the telephone with the commissioner several times, and he has made it clear that it is highly dependent. The reason they're not coming out with one rule for everyone is because it's highly dependent on your local circumstances. And it's just not the same here as it is in other districts or other cities or other towns or other counties. So we have to go with what our local guidance is telling us, not statewide.
Medjean now on 9 Lincoln Street said, I understand that there is a great need for substitute teachers. However, is there a protocol in place if a teacher tests positive and there is no substitute teachers available? Will students be redistributed to classes?
Likely they will not be redistributed to classes. We don't have room to do that. We have to do what we always do, a principal substitutes or a paraprofessional substitutes. It is something that we have to deal with every year, and it is extremely difficult. It's an imposition on the other adults in the building. It isn't best practice, but it's what we have to do in order to keep school open.
Sarah Ibanez, 4 Nutmeg Lane. I want to say I support Superintendent Cabral's proposal and thank the school committee for your work. Our kids under the age of 12 do not have the protection for themselves or to protect those around them in the classroom. I want to ditch masks as quickly as the next person, but I think we need to keep the long game in mind. I'm concerned that a surge in the fall with the many unknowns of the Delta variant, and we could end up right back at home like we did for over a year. One thing I think we can agree on is we don't want to do 2020 again. A mask is a small inconvenience and price to pay to keep these kids learning in person. Thank you.
Thank you.
Michelle Kelly, Bay Road. I also feel as though residents who disagree with or have concerns about the school's decisions are not heard as well as they should be, given that the school committee meetings are held virtually. How do we know that all public comment is actually being heard? I feel that the school committee should hold open in-person meetings from here on out, like many other towns and cities in the Commonwealth are currently doing. Michael Kelly, I'm sorry, I said Michelle. Erica Mandel, 50 Main Street. I may have missed this. Will kids be allowed to drink water throughout the day in their class as needed? Thank you.
Yes, that's always been the case.
Okay. Dennis Gibson. Oh, I read that one. Sorry. Okay. Allison Piantadosi, 27 Priscilla Road. Can you go over the unvaccinated travel guidance from last year? It keeps changing and forget what it needed up last year and forget what it needed to last year.
We're working on the playbook and we'll be sending all of that out in writing. Again, it could change. So we want to really make that as up to the minute as we possibly can.
JC Barry, I can't read your comment because I need your address. Roby Goldstein, how do we keep 3 feet apart with 24 kindergarten students in a class? Robin Goldstein, kindergarten teacher. Oh, sorry. Her address was not there as well. I apologize. Carrie Rapolo, 5 Crystal Lane. As I watch social media and see all of my friends that live in Easton attending sports camps, water parks, amusement parks, outings, play dates, swim dates, summer school without masks, why are you so confident that masks are the answer when I've not seen any COVID outbreaks, including Delta variant, affect these people?
Those are outdoor activities and students will not have to wear masks at outdoor activities.
Nicole Colgrove, 23 Rockland Street. Thank you for working so incredibly hard to keep our children and staff safe. This is such a devastating situation, but I feel grateful that you are all working together to keep our children's health and well-being as your #1 priority. Our pediatrician's recommendations are in complete alignment with yours.
Thank you.
Alicia Isleib, 23 Flyaway Pond Drive. When do you think we will be able to have the school meetings in person again? Okay, sorry, we covered that.
That's not a question for me.
Does Michelle, do you want to address that?
I believe that all town committees right now are still working in the remote model and based on the extension that was signed this past summer by the governor. So as of now, we are all following that and I do not have updated dates.
Cheryl Sclair, 732 Washington Street. I just want to say I feel confident that under your leadership, our children are safe. You've done an extraordinary job with a terrible situation for which there was no rule book. Thank you for everything and for continuing to put both attendance in school and social emotional concerns at the top of your radar.
Thank you.
Michael Kelly, Bay Road, you didn't answer my question. How do we know that all public comment is actually being heard?
Anything that is not obscene, anything that does not repeat the same question over and over again if it's already been answered. Basically everything that was said at the beginning of this meeting. Those were the parameters that were set for this. Anything else is read. I have no doubt Chrissy Pruitt is reading every single comment that fits those guidelines.
Yes, and just a reminder.
Or if it doesn't have an address.
Yeah, profanity doesn't have an address, full name, or if a person has really just consistently put a lot in, because we do want to make sure we get to all of the questions. Dennis Gibson, 185 Lincoln Street. Leisha is 100% wrong about DESE not recommending vaccinated kids go maskless. In bold on the top of page 3, and there's a link. So thank you.
Okay.
Carrie Rapolo, 5 Crystal Lane. Summer school was not outdoors.
Summer school was very different. We had far less students and a lot of it was outdoors. It was a completely different scenario and it was not under the current guidelines or current cases that we have.
Yeah, and the Delta variant wasn't as prevalent then. You know, it was starting to creep out, but it wasn't as the cases are all increasing now. Our case count throughout the state was much lower then. Sandy Santoro, 38 Wilbur Street. I joined the meeting late, so I'm sorry if I missed it. But are there any plans to add a play structure back at Parkview so the children have something to play on at recess? Thanks.
I don't know yet about the play structure at Parkview, but I'm sure Mr. Cedarbaum will look into that.
Michael Kelly, Bay Road. What will happen if a student refuses to wear a mask? What are our options as a parent if we do not want to send our child to school with a mask?
Again, if there is a legitimate medical exemption, a doctor's note to the school nurse, please.
Kathleen Genova, 31 Arbor Way. What facts differentiate Easton to warrant requiring masks for fully vaccinated students when DESE and DPH recommend that fully vaccinated students be allowed to be unmasked? That apparently is for grade 7 and up.
Again, I spoke to the commissioner multiple times after this guidance came out, so I can only tell you what was said in our conversation. And he said that the guidance is specific to not be one set of guidelines as CDC is doing because of the very varied and many different situations across the Commonwealth that we had to base our decision on our very local data. And so we have, and he said that he's not recommending Easton specifically wear masks. So Mr. Kelly, I think.
No, that's Geneva.
I apologize if I misspoke, but that's because I've had conversations with him since, and he has said we need to make a decision based on our local situation.
Sorry, you're correct on that. Greg Shea, I cannot read your comment because it doesn't have your address. Jessica Dubin, 65 Wedgwood Drive. Thank you, Dr. Cabral, Mrs. Pruitt, and the school committee for all of your efforts to keep our children safe. I'm grateful to all of you and think our town is incredibly lucky to have you working so hard on behalf of our children.
Thank you.
Patricia Stokes, 5 Meeting House Lane. I support the thoughtful consideration that the superintendent and the school committee have taken throughout all of this. I fully support universal masking. I think it's a minimum inconvenience. Additionally, I find it very convenient to tune into these meetings online and hope that even once they are in person, that we will have a live stream option as well. I think it allows for much more public participation than only being in person. Thank you for keeping our children safe. Greg Shea, 40 Union Street. DESE's recommendation that vaccinated students need not mask is in direct contradiction to recommendations by the experts at CDC, AAP, and MASC. It is an example of political cowardice, where state officials pushed off tough decisions onto the brave and principled local officials before us today. Thank you for making the right decisions.
Thank you.
Michael Kelly, Bay Road. What are our options as a parent if we do not want to send our children to school with a mask?
Again, it's a medical exemption and you would need a doctor's note. Other than that, certainly you don't have to send them to public school. You can send them to private school. You can homeschool them. And there are 2 virtual public schools that are also an option. I'm not sure if that's what you mean, because the option to be in Easton Public Schools is to get a medical exemption. I hope I've answered your question. I know you keep asking it, so I'm sorry if I'm not answering it.
Dennis Gibson, 185 Lincoln Street. Where do you get the statistic that only 50% of the kids in Easton are vaccinated?
That is from our Director of Public Health and from state statistics. We have access to that information.
Yeah, actually the public has access to that information. So you can go on the website. I just Googled vaccination rates and you can see municipalities, and it breaks it down by age group. So it's a little bit right now it updates weekly. So it'll break it down by what percentage, actually how many are from 12 to 15, how many have 1 dose, how many have 2 doses, and a little bit further information. And then the next group is 16 to 19. So you are very able to see that information. Okay, Lori Hahn, 19 Wenlock Circle. I appreciate how much work is involved in keeping up to date on the science and working within the limits of school space to keep our kids in school. Thank you very much. By the way, the CDC is now recommending all school staff and students mask up regardless of vaccine status. If an outbreak puts in-person learning at risk, and if the state is not allowing remote learning to count, why would we embrace masks?
Why would,
It says, why would we embrace
I
masks?
think it's why wouldn't. I'm
Okay,
sure it
why
is.
wouldn't? Okay. Okay, Kathleen Genova, 31 Arbor Way. Thank you for the response, but perhaps you misunderstood. My question is that you share what it is about the local Easton situation that has led you to conclude all fully vaccinated students should be required to mask.
So that is our management in our school. We have no way of checking which students are masked or unmasked. We have no way of being able to ensure anonymity of students, vaccine status. We don't have staff available for that. Other districts may have staff. Other districts have room for 6-foot distancing. It's just what we discuss as superintendents, what we have available in our district and what we don't have available in our district. And we just don't have the opportunity to do this in our district. We don't have the space. We don't have the people. We don't have the management structure in place for something like that. We're already understaffed and we can't do it, unfortunately.
Tiana.
I'm sorry, Chrissy. I also just wanted to say it was also a recommendation of our Board of Health.
Yes, I'm sorry. I've said that, so I thought maybe that wasn't enough of an answer. We are going by our local medical professionals, but if you're asking on a school level, that's why at the school level we're unable to do it as well.
Tiana. Oh, go ahead, Caroline.
I was just going to say that it would be truly an administrative and monitoring nightmare. I mean, I don't see how teachers could be expected to remember every day, you know, which of the students before me have been vaccinated, which of them have not, who has to wear masks and who shouldn't. And then there's a privacy issue. I mean, not every person who's not vaccinated necessarily wants to be forced to advertise that. So I think the practicality of it is just, the impracticality of it, I guess I'll say, should be absolutely obvious. There would just be no way to monitor it. I actually spoke with a former English teacher recently who said that he could not even imagine trying to monitor, you know, that kind of program where you would just have vaccinated students be maskless and the others masked. He just couldn't even imagine being able to manage that. So I just wanted to add that.
Tiana Moremi, 230 Pequannock Ave. I didn't hear this very well. Are the teachers allowed to stay without masks if they are vaccinated? How will this affect kids' behavior in accepting to wear a mask?
No, universal masking would include staff as well.
Rebecca Luoma, 164 Rockland Street. Thank you, Dr. Pruitt, Dr. Cabral, Mrs. Pruitt, and all the school committee members for the incredible amount of work you have put into keeping our kids safe and most importantly in school. No one likes masks, but we need to utilize the mitigation options we have. In the elementary schools, are the desks still going to be 3 feet apart and facing the same direction?
Are the desks going to be 3 feet apart and facing the same direction? Yes, whenever possible, including during lunch. Well, they'll be further away during lunch if they're not outside, but we're gonna endeavor to have everyone 3 feet apart and facing the same way. It's not necessary that they face the same way according to the guidance we're receiving. That's just what we're gonna try to do, and more than 3 feet whenever we can.
And we do have teachers using tables as well, and that was used in the spring as well.
Yes.
And our kids also sit at tables at lunch, not just desks. Okay, Sarah Parker, 110 Short Street. Thank you, Dr. Cabral, Mrs. Pruitt, and the school committee. I appreciate all of your hard work in keeping our children and the staff safe. As an educator in a neighboring town, I can confirm that what Easton is proposing is aligned with what other towns are doing. I'm in full support of universal masking.
Thank you.
Maria Pacanzi, 5 Wedgewood Drive. Just to repeat, you said there was zero, not one kid transmitted to another kid in the EPS while in school. Just repeating very important data.
What we have seen and what somebody, maybe Mrs. Pruitt said earlier, was that we saw family spread. We saw spread in households. So other than the family spread in households of maybe a child to child in a home, I am not aware of any transmission based on the records that the nurses kept of every student in our district who was positive and who their close contacts were. Now, if somebody did not report a close contact to us, we obviously would have no knowledge of that. But based on all the information we have and information that was provided to us and all of the data that we collected, I am not aware, and I don't, Mrs. Pruitt, you can speak for yourself because you and I reviewed the same data. I am not aware of any spread in school from being a close contact in school.
Monica Halama, 15 Foundry Street. Do you have a long-term plan on masking? What percentage of deaths or hospitalizations will satisfy the school committee to remove the mask policy? You talk about local conditions, but then bring Florida as an example.
I don't know what the percent of death or hospitalization means to remove masks. I'm not sure.
Percentage of deaths or hospitalizations will satisfy the school committee to remove the mask policy?
We don't have a percent. We're going by our local guidance and there's not a metric on that. And I did use local conditions. I said that Bristol County is high transmission right now. That is extremely local. That's us.
Shannon Carrera, Bay Road. Are the children still going to have to eat lunch on the floor at Parkview when they are inside?
That I don't know, but I will say I've been at those lunches and the kids love it. They raise their hand. They want to tell me that they're having a picnic on the beach. They're having a blast. The floor is just as clean as the tables were, and they love it.
Amanda St. John, 25 Kilseth Road. Thank you, Dr. Cabral, Mrs. Pruitt, and school committee for all the time and effort you have put into keeping our kids safe. Will proof of vaccination be required to be submitted to the school as part of health records?
Only if it's to exclude a student from something. So for example, if a student did not want at this time, because again, we don't have staffing in place. If we have more staffing in place and we're able to collect that information, we would. But as of now, we don't have that. Unless, for example, someone wanted to avoid a quarantine, certainly they could do that by presenting verification of vaccination.
And then the last one is Tara Delamere, 8 Winnicott Way. Wait, another one just came up, sorry. Will students be forced to leave the classroom to simply take a drink of water like they were forced to do last year? Kids miss out on important learning time when asked to do this.
No, not necessarily. There are students, again, I saw students with straws who would just put them under their mask and drink right at their desk. It depends on the situation. It depends on how much distance is between students. Again, the idea is to have as much distance as possible between students. If for some reason they're in a situation where they aren't distanced, we're going to default to the safest possible option, and that would be yeah, they would go outside or move into the hallway. But again, it's different than last year in the sense that 3 feet is close contact for contact tracing purposes as opposed to 6 feet last year.
Shannon Carrera, Bay Road. Thank you all for your hard work and dedication to keeping our children safe. Again, I'm not repeating questions, and those that have asked many, many questions. I have been told not to ask those of the ones that have not asked questions. Tristan Warnick, 17 Blackbrook Road. Why would proof of vaccination shorten quarantine if it has been proven that the Delta variant is catchable and transmittable, even if you're vaccinated? Wouldn't a negative test be needed?
Not according to the guidance that we received.
Tara Delamere, 8 Winnicott Way. Are quarantine absences counted as an absence?
Is what counted? I'm sorry.
Quarantine absences counted as an absence. Yes.
Yes. An excused absence. I think maybe that was the intended question, and it would be an excused absence.
Lisa Belsky, 215 Elm Street. I just want to thank you all for doing your job so thoughtfully and competently. As a public school teacher, I have seen this work well. I fully support universal masking.
Thank you.
And Kathleen Sheehan, 10 Harrison Avenue. You have answered the same questions over and over again from the same people. Do I need to go back and tally the number of questions that you've answered and from whom? And then Kerry Rapolo, 5 Crystal Lane. How convenient not to read the questions from those of us asking multiple questions. Again, if this was in person, you wouldn't have the choice to ignore us.
Actually, that's actually not true, because the guidance said at the beginning of this was that people who are asking the same questions over and over again, or people who did not put their address, or people who I can't remember the paragraph that was read. And so far, that's exactly what has been happening. So
Do you want me to reread it?
that would happen in person as well.
Sure. Okay. And according to the directions that were provided to me, that is all we have at the moment.
Okay. Thank you.
And just so that people at home understand, for example, for the 3rd time, the questions asked, when will you have an in-person meeting? It's the same question over again, and that's why it's not being asked.
Right.
Answered, excuse me.
It was discussed.
We did answer it once.
Correct.
Okay. If that's everything, what I'd like to do is suggest that we table superintendent notes, assistant superintendent notes, and school committee notes for tonight, since we'll be having a meeting next week. If that is okay with everyone, can I get a motion to do that?
Wiseman, so moved.
Can I get a second?
O'Neill
Star second.
We always do that.
I know.
Aye.
Give it to Jen.
Roll call vote. Caroline?
O'Neill, yes.
Durance, yes.
DeLuca, yes.
Wiseman, yes.
Star, yes.
Excellent. And just before I go into the next verbiage, our next meeting, do we want to set a date for that next week firmly, or do we want to circle around to that and then get it out there?
You mean the 23rd opposed to the 26th?
Correct.
Monday or Tuesday?
The
I'm sorry?
The 23rd, though, is a Monday, not a
Right.
Tuesday.
Right.
So did we want to do the 23rd, or were you thinking the 24th? Were you thinking that Tuesday?
The 24th, there's a budget subcommittee meeting, so we think it hasn't been exactly set in stone, but that's the recommendation. And 2 of us would be, or 3 of us would be attending that meeting if it is on the 24th.
All right, so do we want to go with the 23rd, or do we want to keep it at the 26th?
I think the earlier the better, so that
I
people
agree.
can plan. Yeah.
23rd is fine.
23rd works for everyone?
Mhm.
All right, and we would have time to get an agenda out there, right? I know Lynn's on vacation, so that's what I'm asking.
We
Okay.
could keep the 26th, as a posted meeting temporarily in case we have, other issues that come up that obviously would need to be addressed at that point.
Okay. All right, so for right now, our next meeting then is Monday, August 23rd. All right. So I'd like to make a motion to enter into executive session, not to return to open session for the purpose of discussing strategy with respect to collective bargaining for the Easton Educators Association, Units A, B, and paraprofessionals. And in my opinion, having this discussion in public would be detrimental to the bargaining position of the school committee.
Wiseman, second.
Roll call vote.
O'Neill, yes.
Durant, yes.
Uga, yes.
Wiseman, yes.
Star, yes.
All right, thank you. Thank you, everybody.
Night.